Medicare 2025, $2,000 drug cap. If those words just made you sit up straighter, you're in the right place. Welcome to 50 cents of advice, dropping dimes of wisdom, 1 50 cent at a time. Your donut hole? Gone. Your maximum out-of-pocket for prescription drugs? It just dropped from $8,000 to $2,000. And if you're one of the 11 million people this affects, you need to understand exactly what changed, because the devil's in the details. I'm Eli Pennywise, and I'm here to cut through the financial BS that nobody else wants to tell you, especially when it comes to the stuff that actually matters for folks like us. Here's what we're covering today: the exact 3 phases of your new drug plan, what counts toward that $2,000 cap and what doesn't, the brand new payment plan that could save your wallet, and 3 mistakes you absolutely cannot afford to make right now. Stick around till the end. I've got action steps you can take today. Look, you've been navigating Medicare for a while now. You know the drill. You know how expensive medications can get, and you definitely remember that donut hole. That coverage gap that felt like falling into a financial black hole right when you needed your meds most. Remember when The Price is Right gave away a year's supply of rice-a-roni? Well, these days a year's supply of prescription drugs costs a whole lot more than the San Francisco treat. The 2025 rules are simpler, more predictable, but you need to understand what actually changed, because your wallet depends on it. Section 1. The $2,000 cap explained. Here's the big change. From January 1st, 2025, you will never pay more than $2,000 out of pocket for covered prescription drugs in a calendar year. Period. Full stop. In 2024, you had to spend $8,000 before catastrophic coverage kicked in. That's like the difference between a used Honda Civic and a used Yugo. Both get you there, but one costs a whole lot less. Once you hit that $2,000 cap, your plan pays 100% of your covered medications for the rest of the year. Zero. Zip nada. This applies whether you've got a standalone Part D or you're in a Medicare Advantage plan with drug coverage. No exceptions. Section 2. The 3 phases. Your 2025 drug plan works in 3 phases. Think of it like Schoolhouse Rock taught us. Simple, clear, and it actually makes sense. Phase 1. The deductible stage. You pay 100% of your drug costs until you hit your deductible, which maxes out at $590 for 2025. Some plans have lower deductibles. Some have none. But $590 is the ceiling. Now, some plans waive the deductible for certain generic medications. Check your plan's specific rules. Phase 2. Initial coverage. After you've met your deductible, you typically pay 25% coinsurance for your covered drugs. Your plan pays the other 75%. This continues until you've spent $2,000 total out of pocket. And here's where it gets good. Phase 3. Catastrophic coverage. The moment you hit $2,000 in out-of-pocket costs, you pay nothing for the rest of the calendar year. Used to be you'd still pay 5% even in catastrophic coverage. That went away in 2024. Now it's 0. Like when MTV actually played music videos. Remember those days? Section 3. What counts toward the cap? Let's talk about what actually counts toward that $2,000 cap, because this matters. What counts? Your deductible, your copays, your coinsurance for covered drugs. If money came out of your pocket for a covered medication, it counts. Also counts assistance from extra help programs, payments from family members on your behalf, and certain charitable contributions. What does not count? Your monthly premium. That's separate, always has been, always will be. And this is critical. Only drugs covered by your Part D plan count. If your drug isn't on your plan's formulary, that's their approved drug list. Those costs don't count toward your $2,000 cap. Using a discount card like GoodRx instead of your Medicare plan? Those savings are great, but they won't count toward your cap either. Section 4. The new payment plan. Here's something brand new for 2025 that nobody's really talking about. The Medicare Prescription Payment Plan. Let's say you've got expensive cancer medications. Maybe you know that in February you'll hit $1,500 in drug costs. Under the old system, you'd have to pay that all at once at the pharmacy counter. Now, you can spread that cost across the entire year in monthly installments. It doesn't reduce what you pay. You still hit the same $2,000 cap eventually, but it smooths out those big financial hits. Think of it like layaway at Kmart. Remember putting your Christmas gifts on layaway? Same concept, different decade. To sign up, contact your plan directly before January 1st if you want it to cover the full year. You can also join mid-year, but you'll only spread costs over the remaining months. This is not right for everyone. If your drug costs are steady month to month, or if your big expenses come late in the year, paying as you go might make more sense. But if you've got a big bill coming early, this could save you from a rough February. Section 5. Who benefits most? About 11 million people are expected to hit this $2,000 cap in 2025. The average savings? About $600 per person. But if you don't qualify for extra help, that's the low-income subsidy program, your savings jump to around $100 on average. If you've got specific conditions like cystic fibrosis, multiple sclerosis, cancer, or you're on expensive biologics, your savings could be $5,000 to $7,000 or more. This isn't theoretical. This is real money staying in your pocket instead of going to drug companies. All right, let's talk about the 3 mistakes you absolutely cannot afford to make. Mistake number 1. Assuming your 2025 plan covers the same drugs in 2026. Plans change their formularies every year. That drug you've been taking? It might not be covered anymore, or it might have moved to a more expensive tier. You need to check your plan's 2025 formulary right now. Go to Medicare.gov, log in, check your drugs. Takes 10 minutes. Could save you thousands. Mistake number 2. Not enrolling in the payment plan when you should. If you know you've got expensive medications coming, chemotherapy, specialty drugs, whatever, and you'll hit that $2,000 cap, don't wait. Enroll in the payment plan before January. Spread those costs out. Your January and February self will thank you. Mistake number 3. Thinking the $2,000 cap means all drugs are automatically covered. It doesn't. You still need prior authorization for certain medications. Your drug still needs to be on your plan's formulary. The cap limits what you pay. It doesn't expand what's covered. And one more thing. Remember when your parents said, "Don't assume. It makes an ass out of you and me"? Same applies here. Don't assume. Check everything. Here's what you do right now. 3 steps. Step 1. Log into Medicare.gov. If you don't have an account, create one. Takes 5 minutes. Step 2. Review your current Part D plan. Check if your medications are still covered for 2025. Verify they're on the formulary. Make sure the tier didn't change. Annual election period ends December 7th, and plan for next year. Step 3. If anything's unclear, the $2,000 cap, the payment plan, coverage gaps, whatever, call your plan. The number's on the back of your card. You can also call Medicare directly at 1-800-MEDICARE. That's 1-800-633-4227. I've put the Medicare.gov link in the description below. Everything you need is right there. Know someone who needs this information? Your neighbor on expensive heart meds? Your brother-in-law with diabetes? Be a friend. Share this video. Drop your questions in the comments. I look through every single one. This is one of the biggest changes to Medicare Part D in decades. You've worked too hard for too long to leave money on the table. I'm Eli Pennywise, and that's your 50 cents of advice. Keep the change.